IVF with self eggs versus donor eggs. So let's not have this confusion. Let's break this down for you. I'm Dr. Suma. I'm a consultant working at Ferty9 Fertility Center, Vijayawada. When couples are advised IVF, the biggest question that they have is, are we going to have our own biological child? Are we going to have a child with our own gametes, or are we going to have a child with somebody else's gametes? So let's break this down. So self cycle is when we use the gametes of the couple who come to us with infertility. So if we use the wife's eggs and the husband's sperm and we create an embryo and we see that they get a pregnancy, it is a self cycle. Similarly, when we use one of the gametes from the donor, it is called a donor cycle. It could be a donor egg, it could be a donor sperm, sometimes it could be both donor egg and sperm to create a donor embryo. So whether we go for self cycle or donor cycle depends on a few parameters, which usually is discussed to you with your doctor. So normally, at least in Ferty9, we try our best to do self cycle for any couple who approaches us, because of course every couple wants to have their own biological child and it is their right to give a trial to have a pregnancy with their own gametes. So usually whenever we do an ovarian stimulation, we stimulate her ovaries, we get the eggs, then we take this husband sample, we select the sperms, we do fertilization in the lab, we create the embryos and we transfer it back into the uterus. And this entire process, your gametes are safeguarded with an RI witness coding system to make sure that they are your own gametes, they belong to you, and you can go ahead with the cycle with utmost confidence. So in certain patients, donor cycles are also indicated. So when the ovaries have completely been depleted of the eggs, like in a premature ovarian failure, or sometimes patients come to us after menopause. It happens very commonly, especially in a person who has lost their child at a teenage and they want to have a pregnancy after menopause, or the husband has completely zero sperm count and the hormones are not very they're not very complacent with going for self gametes even through a surgical sperm retrieval. So, or in a couple where they have some genetic problems which should not be passed on to the next generation. So they've had previous kids with genetic issues, and or they have some known genetic problem which they do not want to transmit to the next generation. They can opt for a donor cycle. So whether you go for self or you go for a donor cycle is absolutely your own decision. Your doctor will give you your options and you can choose between the two. At Ferty9, we try our best to go with self cycles, even if in patients who have very less eggs. We have certain standard operating protocols wherein we can get the maximum even with patients with less eggs, like doing a very gentle retrieval, selecting the best sperms, using the best possible microscopes to give you the best chance of parenthood with your own gametes, but only in certain situations where it's really necessary for a donor cycle. You will be advised, you will be told, your consent will be taken to go ahead for a donor cycle. So I'm proud to say that in Ferty9, almost 80% of the times we go ahead with self cycles and we're able to deliver world-class pregnancy rates. Thank you.